the chair, and I'm one of the deputy chairs of the UK SRHR network. And as a network, reflecting at the end of 2020, we're just really thinking about, COVID has pushed us to adapt and change how we work and move things online. And we're thinking, gosh, it also has pushed forward digital innovation in our work on SRHR and HIV. But, it hasn't been the only factor. We've been working with digital interventions for a while now and trying to, sorry, just like, and trying to stay relevant and meet people where they are. And, one of the things that really kind of stood out for us was that a lot of us in the health and development sector are drawing on tech, but we don't often have the opportunity to practically engage each other and learn from each other and kind of share that journey. So, and also I think, we recognize over the last year, there's been a lot of webinars, a lot of online events, and we've all just been trying to figure out how to be present in this new online world. And there's been a lot of broadcasting and showcasing of our work and what we've done. But very few of these spaces have allowed for some of that nitty-gritty conversations that we might have had in the corridors and of these meetings and conferences. So today's session is an attempt to create this type of a space for some practical conversations about what worked, what didn't work, sharing advice and ideas if you're working on or thinking about trying a chatbot. And we're really hoping that this is, one in several sessions that will help kind of strengthen cross-sector collaboration and partnership among technology developers and also development actors, and help build this practice or kind of habit of collective problem solving. So we're learning as we go. At the end of the session, please give us feedback in the chat about what you liked, what you didn't like, and also what other digital innovations you'd like to talk about in the future. Please do introduce yourself in the chat. Also, as we go, questions and answers. So I'm going to hand over now to Erica just to walk us through the session and our time together.
Good morning, everyone. I'm Erica Belanger. I'm the Executive Director at SafeHands. And we at SafeHands put SRHR information into the hands of women and girls. And over the past 2 years, we've really been looking at how we co-design and test mHealth solutions to improve access to SRHR information. And one of those is Ask RHU, a chatbot that we'll be discussing later in the session. So just to walk you through the format of this morning's session, we'll be learning more about 3 chatbot interventions, Ask RHU, Boostbot, and SelfTestBot. Panelists will have about 10 minutes to provide an overview of their chatbot, for who it was developed, why it was developed, who it was funded by, and some of their biggest challenges. And then we'll really be encouraging a practical discussion with presenters and participants to learn and exchange from their experiences. I'm going to really encourage you to use the chat function to ask any questions or share your experiences or your intention to develop chatbots. And at the end of the session, we will summarize the discussion and also ask, as Felicia said, any ideas about future sessions. And on this topic in particular, we'll be producing an FAQ about chatbots that synthesizes this discussion and some of the experiences that have been shared. So I'm going to hand back over to Felicia.
Thanks, Erica. So let's kick it off. I'd like to hand over to Reproductive Health Uganda, who with Erica, and also Say It Now, who's going to give us a walkthrough. Oh my gosh, Ask RHU. Sorry. Let me hand it over now. Go.
Great. So I guess it's back over to me. I'm here with the Ask RHU team to talk you through how we implemented our chatbot from concept, co-design, live testing, and eventually full scale up. And working in partnership, I'm joined today by the rest of the Ask RHU team, which is our chat commerce partner, Say It Now, who's represented by Sander, and our implementation partner, who's represented by Fortunate from Reproductive Health Uganda. And you'll be hearing from each of them in just a minute. So I mentioned before that in our work at SafeHands, we really look at how we put information, SRHR information, into the hands of women and girls. And we heard a lot from young people who told us that when they searched online for SRHR information, they were bombarded by fake news, anti-choice messaging. So we really wanted to design an mHealth solution that could improve young people's access to instant, accurate, and reliable information. So in 2019 to 2020, we did just that as part of our knowledge and information on safe sex project that we're implementing with RHU. So Ask RHU really turns a mobile phone into a trusted SRHR advisor using Facebook Messenger. You ask a question, you get an answer. So you currently, Ask RHU can answer questions on family planning, unwanted pregnancy, and HIV, and provide you with a GPS location to your nearest clinic if you ask for it. And in 2021, we'll be scaling up with more content around menstruation, consent, and other areas. So Ask RHU uses artificial intelligence to analyze, predict, learn, and inform decision-making. And we're really using the proven evidence that Say It Now has shared with us about chatbots, that it's not a replacement for services or information, but it's a service that can really enhance and improve the quality of care that people receive on SRHR. So I'm going to hand over to Sander because he is the expert on artificial intelligence, not me. And he's going to talk us through the main functionalities of Ask RHU, and then Fortunate will overview that real life experience of what it really looks like on the ground when we've been hosting the live testings. So first over to you, Sander.
Thank you, Erica. So my name's Sander Season, and I work for Say It Now. So we're a technology company based out of London, and our expertise in chatbots and voice services, so Alexa skills and Google Actions. We were approached by Erica to help develop a product for RHU to help with servicing their community. We were technology experts in this area, but had no experience with providing this type of help. So our first step really was to get information about exactly what the problem was, who the people were that we would be providing information to, and what they needed. So to do that, we organized a workshop actually in Uganda, and RHU brought together a great group of people with healthcare practitioners, youth ambassadors, and people who are really on the front line every day. And we went through a formulated workshop with them to discover what type of product we would make. And we had at that point no conception of which technology we would use, how we would do things, what interface we'd be making. We came with a real blank canvas. And we started to work with these frontline workers to figure out what was necessary. So we talked about, what kind of people there were, and we created a user persona for every single type of user, from a young female to a slightly older male to someone who was already had an established family and was more thinking about family planning. And established, for those people, what type of technology do they use? What type of problems do they have? What's their social situation? How do they access phones and other things? And from that, we moved on to the topics that they were interested in. So focusing on different topics of interest and what would be most valuable for them to get and how. So from that, we started to formulate both our content and technology strategies. So from a technology interface, Messenger, Facebook was a very common theme throughout all the users. All of them had access to it, so we chose to use Facebook Messenger. And then to do the back end of thing, we use a quite advanced system, Google Dialogflow. So that's very good at understanding sentences and interpreting those into intents. And we decided to focus together with the RHU team on family planning, HIV and STIs, condoms, and other topics. Now, it's important that we always do these chatbots, whether we're doing them for commercial or this type of purpose, to do it in an iterative way. You can't answer every single question. You won't be able to create an expert system on day one. So we were focusing on several topics and the most frequently asked questions. I'll just share in the background. So in terms of an interface, rather than leaving people at a blank screen with a blinking cursor, we also provide a menu. So people can navigate through things as if they're navigating a website. They'll be able to press buttons and navigate through the different topics. But we also can recognize up to 150 different intents through all kinds of sentences with misspellings, different forms of questions, and it will provide accurate signposting to the information. If it doesn't understand, it will try to guide users back using suggestions of topics that they should ask for. Because we develop with Google Dialogflow, all the expertise sits within Google. We their language and intent recognition constantly improves. So with usage, the bot will improve and its recognition will improve. In addition, with Google Dialogflow, we can add interfaces in the future. We can add a specific web bots. We could add WhatsApp as an interface in the future, because it's just a channel and all the intelligence sits with Google Dialogflow. At the moment, we're kind of still in a testing or beta phase, trying to get the content really correct and the recognition of questions correct. And the next real phase is to get mass input so that we have a larger base of questions to optimize the AI to answer correctly. That's it from me. I'll hand over to Fortunate.
Fortunate, you're on. Yeah.
Thank you so much, Sandra. And here in Uganda, Reproductive. So Fortunate here from Reproductive Health Uganda. Reproductive Health Uganda is the NGO that is taking this on, the Ask SRHR chatbot, and piloting it in the different places. Reproductive Health Uganda, or RHU, is one of the oldest NGOs in the country since 1950. And it runs clinics countrywide. So in each district of the country, we have a clinic. And one of our major targets is young people. And young people always come to the clinics, not necessarily for services, but they will need the information. And Uganda has one of the youngest populations in the world, with over 68% being young people. So Ask SRHR comes in timely to give young people access to information on especially safe sex and where to get some of these services and get tested or get a family planning method. So the name itself was actually developed by the young people. Sandra and Erica and the team came to Uganda, and a couple of young people sat together and thought about the different names we could call this chatbot. They came up with which platforms they thought most people were on, and actually Messenger came out most. As one of the most widely used to see if it's giving correct. Each time a prototype comes out, we get a few young people, say 20, 30, to try it out. And then, yeah, we always try to make sure it gets.
I think oh no, I think Fortunate might be in the process with the connections, obviously.
Ugandan internet isn't always perfect.
No,
I'll pick up where Fortunate left off. So yeah, we are doing
Great.
iterative testing. So we get about 20 of the youth workers to ask questions of the bot. We record all the successful conversations, all the unsuccessful conversations where either no information or bad information is given. And then we feed that back into the Google Dialogflow model so that it improves its recognition each time. So we're pretty much, after several of these cycles, ready to go to a wider audience and launch to a test area within Uganda around Fort Portal to get a wider set of real user feedback rather than the youth workers.
Thanks. You guys have 1 minute if you want to have any last bits before we.
Sure, I'll just summarize a few points. And even though Wi-Fi can be very spotty in Uganda, we were absolutely blown away with the coverage of 3G in the country, the whole way from Kampala to the area where we're doing this testing in the Southwest. We had 3G the entire way. So, you know, mobile coverage is actually really quite high, and quite higher than the data suggests in Uganda. So I would just end by saying that as we move to the next phase of Ask RHU, we're really looking at that continuous improvement of service, that constant integration of user feedback, and really trying to capture as much evidence of the value of a digital solution, looking at how we reach people that may be left behind, and also the service sustainability and how we make sure that the service always remains free but doesn't have to rely on a generous donor. And I just end by saying one of our biggest challenges has really been balancing the quality of the service and the need for the continuous improvement before we do a live launch. So using that minimum viable product model that Sander mentioned, we know our service isn't 100% perfected on the day that we launch it. And we really need that iterative process to be able to generate that continuous improvement. But we also recognize we have to balance that with making sure we don't provide false information and we don't make young people lose trust in that information source. So that's been a constant balance. And I would say one of the reasons why we haven't accelerated as fast as we would have liked, because we want to get it right, but we know it's not going to be perfect the first time.
Fruits and vegetables or provisions.
Thanks so much, Erica, and the Ask RHU team. So I'm going to hand over now to Nadia Yanho from Alliance for Public Health based in Ukraine to talk about a self-testing bot.
Just a moment, please. Share my presentation.
Did you want to? Oh, okay. Yeah. Perfect.
Yeah. Hello, everyone. The topic of my speech is chatbot, new approach to accessing HIV self-testing. And before I start, I want to apologize for my English or maybe pronunciation because it's not my native language. So my name is Nadia Yangol. I am a project manager of International Project Department in Alliance for Public Health in Ukraine. And now I am dealing with issues related to COVID. But previously I worked in the program department and was involved in management grants with support of Global Fund. And I deal with the full cycle of grants, like from their development, management, staff training, monitoring, data analysis. And I have more than 15 years of experience in issues related to HIV, TB, hepatitis, and about 10 years of experience in HIV prevention projects. The success of HIV prevention programs among key population lies in the philosophy of harm reduction programs, where the client receives all services on the basis of NGOs, like consultation, consumables, HIV testing. And the spring of 2020 and the appearance of COVID in our life forced us to reconsider our approaches, and as a result of programs and containments of HIV epidemic were threatened. And under the quarantine conditions, clients didn't have the opportunity or refused any contact with the organization social workers, and which made it impossible to provide a range of prevention services and increase the risk of new HIV infection among clients. That is why during the strengthening of quarantine measures related to COVID-19, the innovative method of interaction with clients was developed and implemented, which included physical contact of the clients with the employees of organization. For the convenience and comfort of clients, the Telegram chatbot was created, with the help of which you can conduct self-testing for HIV at home. In this slide, you can see like offline services and online. Offline, it's clients come to NGOs, and online, we see like all services come to clients. The main tool for implementation for implementing the intervention was the development of an automatic Telegram chatbot, which acts as a living instruction for self-testing for HIV at home. To do this, a video was made with instruction for self-testing for HIV, and other options are provided. And thanks to which the client can get the service online, and if desired, get feedback from any specialist through a telephone consultation. This project has its positive reviews and is popular among community, as it's not only a convenient method, but also safe in quarantine. We set ourselves the task of development a simple, time-consuming, and accessible bot. To do this, we even involved the clients themselves. For example, the video in this chatbot were shot by the clients themselves, and the first testers of this chatbot were our clients. So I just to understand and how it looks like, I just show a short video. I try that it works. Yeah. Just can see how it works and how it's easy to use it. I mentioned about this video, and we have another one. And these videos were shot by clients. We involve clients in the development of our chatbot. And we have another videos, and social workers can send clients if they ask. The essence of a new intervention is to replace the service of assisted testing to self-testing with a rapid test for HIV or STI, and with further information about the test result and registration of client with negative or positive results of rapid HIV testing. So how it works? How it works. Those wishing to take the test receive an HIV test for themselves, or if necessary for their sexual partners. And after they scan QR code from the test package in free time or inconvenience place. Pass the survey in the chatbot. 3 languages of communication are provided. It's Russian, Ukrainian, and English, and receives an individual client code. Watch instruction or video for HIV testing and take HIV test. And chatbot helps to correctly confirm the test result with instructions, and regardless of the test results, the chatbot offers the client to use the advice of specialists and learn about our services and how they can obtain in quarantine. And in case of positive results recorded by the client, the chatbot will insist on the client contacting the social worker by phone, or provide addresses on non-government organization or medical institutions. Given that quarantine measures and restrictions are increasingly daily in our country, the chatbot is becoming an increasingly promising analog of the provision face-to-face services, and provides an opportunity to minimize the risk of COVID-19 infection, continuous HIV prevention programs, and expand coverage. The services in hard-to-reach regions or places where such programs are not provided. In 2020, the chatbot was tested in 2 cities of Ukraine among trans people, and in 2021, it was included in prevention programs throughout the country as an alternative of HIV testing. Its development perspective has the potential to cover all regions of the country and all key vulnerable groups for HIV, to HIV, like sex workers, men who have sex with men, people who use drugs, including general population and youth. Of course, we can see disadvantages. It's like there is no clear mechanism with HIV positive clients, and lack of post-test consultation immediately after testing. And regarding of the name and purpose of this conference, I think that planning healthy habits, it's opportunity to gain new knowledge and skills, as well as instills a good habit to continuously take care of their own health. So thank you very much.
Great, thank you. Thank you so much, Nadia. It's really interesting to see how already kind of the different chatbots have this really different function. Like, and this one is like around that accompaniment. So I'll hand over now to Avert, to Rosie and Simon, to talk a bit about Boostbot, which is a resource for community health workers in Southern Africa.
Great, thanks very much, Felicia. I'll just quickly share a slide for background. Great. So yeah, my name's Simon Moore. I'm the Director of Communications and Digital Health Strategy at Avert. Yeah, very pleased to be here today for this discussion about chatbots. For those of you who don't know Avert, we've been around since early on in the HIV epidemic. We're a provider of trusted and accessible digital content, aiming to build knowledge and health literacy on HIV and sexual health. So I'm just going to start off by giving a bit of background to our chatbot project, and then I'm going to hand over to my colleague Rosie, who's going to talk through more of the challenges and the learning from the project. So our chatbot is part of a wider information resource called Boost. You can see a few slide shots on the screen. And Boost was developed as a tool for community health workers and peer educators in Southern Africa to support their ongoing learning and to support their interactions with their clients. Boost has been co-created with over 100 community health workers in Zimbabwe, Zambia and Malawi. And it's being rolled out across a number of different technical platforms to try and maximize access to the resource. So those platforms include a progressive web app, a native app, a version for KaiOS, which is the biggest kind of operating system for feature phones. And then the focus of today's discussion, a WhatsApp-based chatbot called the Boostbot. So it's just kind of important to say that all these different ways of accessing Boost are all kind of integrated into one integrated content framework in the back end, and Rosie will talk a little bit more about that. So one thing that came out really clearly from our original scoping and co-creation process for Boost was that a key thing that community health workers wanted was help with answering difficult questions with their clients, from their clients. And they were going through quite lengthy processes to find and to refer questions to relevant people to get the answers. This was usually a sister in charge, but also could be other types of people from neighbours, relatives, and others who weren't necessarily equipped to answer the questions. And the Boost app and the Boostbot have both been designed to be a really quick and easy tool that community health workers can use to get reliable answers, including in real time while they're with their clients, so they're not losing the opportunity to have that information at their fingertips. The Boost app was launched last year and has been rolled out to around 1,000 community health workers in Zimbabwe through our two partners, Avert and Africa's Vanduri. And that's as part of a case study that we'll be externally evaluating later this year to kind of see the impact of the program overall. Boost in all its different forms is freely available and is also being piloted by a number of other organisations in Zimbabwe and in other countries in the region as well. So last September, with funding from Gilead, who also funded most of the wider Boost project, we started work on the Boostbot, on the WhatsApp version. And this draws, as I mentioned, on the same content management system as the Boost app. The Boostbot is undergoing final kind of testing and completion at the moment, and we're hoping to start rolling it out later this month. Initially, its primary users will be the community health workers with Avert and Africaid as part of that initial case study work that we're doing, but it will also be available to other community health workers in the region as well. So that's just a little bit of background, and I'll hand over to Rosie now to talk a little bit more about the detail.
Hi everyone, I'm Rosie Bernard. I'm a content editor and project manager at Avert, and yeah, as Sam says, I've been working on the development of our Boostbot. So just to begin, Simon, I think if you could just stop, perfect. I'm just going to show you a quick video of the Boostbot in action. So here we go. So as you can see, we're using WhatsApp for our Boostbot, and this is just an example of a typical user flow. And there we go, that is Boostbot in action. Yes, so I'll just start by telling you a bit about the technology that we used to create Boostbot. So we chose to use Twilio, which is a conversational AI platform for building bots to program and train our bot. And we chose Twilio for two reasons, really. Firstly, it uses cloud-based natural language processing, which is important for the nature of the user interactions with our bot, as it's primarily a learning and question and answer tool. And we also chose Twilio because it offers an omnichannel service across WhatsApp, as well as SMS, voice, Facebook Messenger, Google Assistant, and other platforms. So we have that scope to expand if we choose later in the future. And we chose to start with WhatsApp as the platform for our bot because it is firstly the cheapest platform for our users. Many of them buy WhatsApp specific data bundles. And also since the COVID-19 pandemic, we've seen that the majority of community health workers' work has migrated to WhatsApp as they can't do face-to-face sessions under lockdown. So in terms of the team on this project, at our side of that, we had two content editors, myself and my colleague, who led on the co-creation and content development of Boostbot, as well as programming and training it. And we worked with an external developer who led on development, and this included enabling the bot to retrieve content from the back end of our Boost API, which stores all the content, and also linking the bot up with Amplitude, which we use for more detailed analytics of our users and the conversations they're having. So moving on to content development. As Simon mentioned, we drew on our existing knowledge base from the Boost API rather than creating new content. So we have that one backend that is feeding through to multiple content platforms. And in terms of the volume of content, Boost has 39 units across 9 sections, and that's covering HIV, sexual health, and most recently COVID-19. And this content on Boost was already developed in short form and with images, which was a real advantage for us. It translated well for the requirements of the bot. But that being said, we still found that we needed a lot of time to break up and repurpose the content in order to make it meaningful for the bot. And in general, just the challenge we found of putting this content into a logical question and answer structure was something that really struck us. So I guess the key learning at this point was that you really can't underestimate the time needed to develop content for a bot, particularly of this scale. So looking at the co-creation element of this project, we worked with user testing groups on WhatsApp, on scoping, content development, and testing the bot. These groups were made up of community health workers from our partner organisations. They had already worked with us on the initial development of the Boost Progressive Web App, which we launched a year ago. And so they were familiar with the concept of Boost, which did give us an advantage. Still, we did have some challenges at this stage. We found that it was challenging looking at the volume of content we had and finding a way for meaningful engagement across it. And this is ongoing, really. So once the bot is launched, we'll be continuing to monitor and train it, just so that we can keep refining this content. But what we did find from the co-creation phase is that there was a clear positive demand for the tool, and we received a lot of early positive feedback about both the familiarity and the understanding of the bot as a way of accessing information. And we also gained some valuable learnings about the functionality and the content of the bot. We found that users thought it was really important to include images within the chat, and also our learn more prompts, which I'll talk on in a moment in more detail, were well received as well. So looking at the development and UI stage, we approached this by creating a beta version of the bot with limited content around 2 topics, COVID-19 and HIV. An introduction to HIV, what is HIV, to test with the user groups. And this gave us an insight into how the community health workers would use the bot in general. And it also enabled us to make sure that the functionality was working before we started building out across the other units. We spent a lot of time understanding how the users would interact with the bot and the user flows to make sure that the bot is intuitive for them. And through this, we really uncovered the importance of providing clear user journeys, partly due to the volume of content we have on Boostbot, but also the nature of the bot. It's all about trying to build community health workers' knowledge by guiding them through to the content that they didn't know they needed to know, as well as answering the questions that they're asking about. And we do this by encouraging exploration of other topics. So as I said before, we have learn more prompts, which signpost to other content that might be of interest. We had a few challenges in the development phase, mainly around the fact that we were providing purely information and learning rather than being a service tool. We found that much of the technical and help documentation for Twilio is aimed at bots designed for ordering products and services, and so this doesn't always translate easily to a bot designed to provide information like Boostbot. So yeah, that's an overview of the development up to where we are right now, and I will pass back to Simon.
Great, thanks, Rosie. Yeah, so I think that's really an introduction to Boostbot. I think it'll be interesting as part of the kind of discussion that we're coming up to sort of talk about some of the issues around kind of developer input and sort of how people have used developers, and also around kind of insights and analytics, I think were other areas that we kind of spent quite a bit of time thinking through. So it'd be interesting to kind of talk with others on that. But yeah, hope that was a useful introduction to the Boostbot. Thanks very much.
Great, thanks everyone. It was such a no, it's really interesting because I feel like when I hear about kind of these chatbots, I hear about one kind, and it's really rare that you hear about the different types in one session or all together. And I can almost see kind of a package. Okay, and I want this one from that one or that one. So now we've come to, and we've amazingly, crazily on time, very close to it, come to our Q&A session. We have about 30 minutes. My colleague Sally has been monitoring the chat, and also people have been sending her some messages. Sally is actually the technical lead on key populations and also leading our work around digital health and mHealth. So why don't I think there's two pieces of it. I'll hand it over for Sally maybe for a couple of questions, but also I'd really encourage kind of the different also speakers who shared about your chatbots to also ask each other questions, because you've been in it, your questions may be a bit different than kind of people who are still learning and are wanting to know a bit more. So I'll hand it over to Sally.
Hi everybody, thank you for the questions that you've sent in the chat. What I'm going to do is just read some of them, and then for those that aren't directed to a particular speaker, anybody can answer, and some of them are directed specifically. So Jennifer had two questions. One of them was what level of ongoing support is needed to maintain the chatbot once it's live? I think that's an important question for resource purposes. Sangeetha also had a question around for Nadia on where the pre-testing counseling happens before the self-test happens. So if there's a, I know that you had that the video, but there's a question about whether there's pre-test counseling available to people doing the test. And then Sangeetha also, Jennifer had a follow-up question about the a referral. Is there a referral to someone or someone else where you can't get information? So when the system is running, the chatbot is running, and there's a question that it can't answer, how does it deal with that? Is it does it refer, or is there some kind of process to deal with unanswered questions? One more question from Sangeetha is around the question of privacy to all the speakers. Do you have a safe viewing mode built into the chatbots as a risk mitigation strategy? And do you also speak to users at inception to ask or to tell them how to delete or hide chats if privacy is a key concern for them? So if you have any sharing on that, she'd appreciate it. I think that Sophie also has a question around donor flexibility. I think we can hand over. Let's do this first round of questions, and then some more might arise, and we'll ask Sophie to share a question once you've answered these first ones. Great, so whoever wants to start off first to tackle those questions.
Maybe I can start and answer the questions that was addressed me about pre-consultation. So in our work, the social workers delivers the test to the client, or he can take it from the box in the office, because a lot of NGOs now are closed and just provide services just in the door. close to the door. And of course, in this situation, the social worker provides short consultation in live or by phone. And also we have such, I did not mention, but we have a short instruction that each client received with the test about, it's like an information leaflet printed in the paper with the first steps how to use this chatbot, and with 2 short questions about behavior of the client. But honestly, when I received this question, I start thinking about to add small link or small bottom in chatbot and add this to our chatbot. Yes, thank you. And maybe I don't remember all question, but another question was about ongoing support. I just also try to answer in our experience, and technical support from the developer. It's in our case, it was you must have a server location where you store information. So this service cost about $30–50 each month, and in our case it was free for us because we just agreed with the development's contribution to our common deal. And for development of our chatbot, it's cost in Ukraine it's about $1,000, like this. Just answered for 2 questions. Thank you.
Maybe if I can follow on from Nadia, just around those support costs. I think one of the questions we are still investigating, or we're trying to kind of improve on, I suppose, is around some of the small costs that Twilio has for each interaction that you have with the bot. So it's sort of an interesting one in terms of budgeting and future budgeting, that you're obviously trying to maximize your impact and usage, but that kind of has an increasing cost. And I think there are ways of and opportunities to reduce that cost through kind of working with Twilio and kind of corporate social responsibility type approaches. But it has been kind of an interesting one so far, in kind of thinking about those ongoing costs. I think otherwise for us, it's been very much about kind of planning both how the kind of the staff capacity for kind of constantly improving the answers that the bot's giving, and dealing with the kind of misallocations and questions that are being answered wrong. I think for us also there's a kind of planning in time and capacity to be able to make the most of the insights that we're getting from the questions people are answering as well. So people are asking the bot, and we can use those insights to understand what development, what content we might want to, new content might be needed in the bot, and also needed across the other platforms of Boost. So it's kind of, it is kind of an ongoing live and developing project. And I think that's kind of one of the issues for us.
Very similar on our side. The overall technology costs are fairly minimal. The platforms we use don't have a per question cost, but they do have like a monthly licensing cost, but that's generally quite low, under $100 a month. It is mainly the personnel cost of looking at the questions, monitoring the things, and then improving the answers when they do go wrong. We are doing that as part of the project scope. We actually factored in the different iterative stages in the beta, and then a live launch followed by analysis and improvements. And we have a method where non-developers can actually contribute to the question-answer pairs, so that we can get one of the youth ambassadors at RHU to actually monitor and improve. We can train them up so that they can spend, a proportion of a day a week is all that's really required to do that ongoing monitoring and improvement when it's small improvements. And then if we do major new content sections, we would start a new project. Just to move directly onto the referral, it's not something we implemented yet, but there are a few options for that. So in other bots we've implemented, you can kind of put a frustration counter in every time an answer goes horribly wrong, or the user starts to get frustrated. If that happens 5 times, you kind of end the conversation and refer them to a different channel, say a phone number or an email address. And the other thing is there is a live handover functionality built into the platforms that we've used. So you can ask in natural language to speak to someone. And at that point, the conversation with the bot is stopped and the conversation via Messenger starts with an operator that is ready for that. Again, not implemented in this phase, but we do have that facility to do a live handover at a later point.
I would just add on Ask RHU, the question about privacy was something that definitely was at the top of our agenda. And that was the reason why we picked Facebook Messenger, because for young people, WhatsApp was just too risky in terms of privacy. With Messenger, I believe in the onboarding, there is a discussion of make sure you log out if you don't want people to see it on a shared mobile phone. And actually agreeing a donor to take a risk on us was probably the biggest delay that we had when we came up with this idea. First, we tried to refine it into a concept that could be submitted to a donor, but as an innovative process, we didn't have any data, we didn't have any evidence. It was just kind of a pipe dream that we were looking at somebody taking the risk, and then actually we included it in a legacy donation that we ended up getting, so we had a little bit more flexibility. But that grant is actually being administered by a foundation, and through building that trust and some of the evidence that's now coming out, we actually do have funding for the next round now that we've been able to demonstrate that. But it was so difficult, I think, in the beginning to go from this idea to even getting my own organization to take the risk of really investing in this, and the questions of why Uganda, what does the data look like, what would the acceptability be? Yeah, those are some of the challenges we had.
Anyone else want to kind of come in on the questions that Sally put into the chat?
There's one more interesting question that that Jan is asking about, I guess, around legal responsibility. Jan is from South Africa as well, where telemedicine has only just been regulated and is more allowable. And she asks, if the question is lost in translation and the answer given is incorrect, would there be recourse against the NGO? So if someone's given sort of medical advice that is incorrect, I wonder, I guess it's pretty important to make sure that there is legal protection, or at least you're telling users that they need to use more than one source of information, I guess, or I don't know. So that's a question from South Africa, from Jan. Does anybody want to address that one?
I just can maybe not answer, but comment that in our example, when you receive the package with test, you have QR code, and close to QR code, you have a telephone number of the social worker. And the main bonus of using chatbot is that the clients understand that he or she speaks with the robot. It's not, it means that we provide confidentiality, just to understanding that you speak with not with alive people, you speak with machine. So just all information that you give this chatbot or you give this robot, just a priori we don't use it. And if, for example, in our case, something wrong, or for example, the chatbot gives wrong understanding of the result, it's just one way to clear this question, to call the social worker and maybe come to organization and receive the answer. And it's, I think, that the main and good things using chatbots that I mean, okay, just stop. I think that you understand my thoughts. Yeah.
Just maybe one comment as well. I think that for us, providing information through mainly through the chatbot and quite a broad range of content, we were keen to try and have quite the initial interaction when people start their first interaction with the chatbot, to have a kind of conversational start where the chatbot could explain what it was and wasn't able to answer. So there's an initial, when someone first messages the chatbot, that it will come back and explain a little bit about the areas that it's able to answer questions on and things that it can't, to try and sort of frame that, those expectations, I suppose, so that we are not getting people asking questions that there's no chance that the chatbot can answer.
Sorry, because I just got kicked off. I don't know what happened from that. Thanks. I didn't know if anyone else had. I had a couple of questions if I can also jump in, if that's all right. I think there was a question earlier about kind of actually, this is actually coming from one of the questions in a program that's being run at Frontline AIDS. And so there's this project called Ready. It's around young people living with HIV, and they're thinking about, a technological solution. And they're saying, I think we want a chatbot. And they've gone through this kind of back and forth for like quite a while. And, so I think, the question was like, how do you decide what's the right technology for the right purpose and for the right users? I feel like this is something that you can go around and around about for a really long time. So just wanted to, ask, like, how did you guys go about that?
Yeah, as I mentioned, we before the workshops that we had in Uganda, we didn't have a technology plan. We had a variety of options in front of us, and we really took input from, what devices are people using, what services are they using, what platforms are they on. Before we made our plan, there were a variety of different options that we had in front of us. With similar considerations to the stuff that Avert was talking about. We wanted to make sure that we were omni-channel in the future. We wanted to make sure that we were reaching users with the technology that they had available. So when we discovered that phone coverage was pretty ubiquitous throughout Uganda, and phone access was pretty much 100% amongst the youth, we kind of nailed it down our choices. We looked at cost considerations, and Twilio was definitely on our consideration list, but we just went a slightly different way due to some of the features that we had in the platform that we eventually chose, which was Google Dialogflow and Chatfuel. But it is taking it from the users, from the purpose, really letting the users drive the requirements rather than coming with a pre-built technical solution that you'll apply to the problem.
Yeah, I think adding to that, I mean, completely agree. I think with the Boost project, because it started very much with that kind of co-creation scoping phase to understand what was already there, how community health workers were how they were interacting with their clients, what their knowledge gaps were, what the things were that weren't working, and kind of from that starting point then trying to work out what was it that would be helpful to them. And so at that first stage we identified a few different kind of technical options, I suppose. So the progressive web app that we ended up developing first, which was something that was data light and could be used offline to kind of enable where there's less connectivity and data costs and things, but always with the idea that the chatbot was something, and specifically WhatsApp was the kind of preference for people as well. In relation to the linked question someone asked about kind of donor funding, we initially put in a proposal for funding that would have been for both the progressive web app and the chatbot. We didn't get all of the funding that we wanted, so we started off with the progressive web app and then went back to the same donor to then get more funding to do the chatbot. And I think actually that worked out very well. We developed all of the content, as Rosie said, for the progressive web app in a way based on what the community health workers wanted, which was really short form visual content through the app that was actually already doing half of the work to get us towards the type of content that we needed to start feeding into the chatbot. So, but very much that kind of scoping phase was so important just to really understand the context that people were working in and what was going to make add value to their kind of their work, their way they were working and their effectiveness, and also understanding from the organizations as well as community health workers, understanding the ways that they were supporting and mentoring their community health workers, and some of the kind of capacity constraints that they had as organizations in providing that ongoing learning and development for their community health workers, and how the Boost app and chatbot could kind of support and help with those mentoring and support programs as well.
Really sorry, just like a little bit of a phone. I was just for people kind of who are thinking about this and, you know, like who should be on, you know, who should you be involving? Because I think obviously it's like, you know, the people who it's benefiting, but, you know, who else, like who would you advise as like that team? Because I think a lot of us might not have that tech partner on hand. Like how do you, you know, what would you suggest, or how do you look for one?
I guess from our experience, when we first did the scoping, we didn't have a tech partner. I mean, we're an organization that has quite a bit of experience in doing digital projects, and we understand technology, but we're not developers at all. So we use external developers to support us on our projects. But I think that first kind of scoping phase was just really not about technology in a sense. It was about understanding the needs and what was going to make a difference, and then kind of once we had that, we were able to then engage with developers and kind of then talk about the different options and bring that part in. But I think the very first stage was really just understanding the problem and the context and the way that people were working and interacting with their clients.
For us, the co-creation phase was just so critically important. When we were finally able to sit all together in Uganda and have these conversations with, you know, people, peer educators who deal with these questions every day. We also brought in a youth-friendly service provider from the local clinic, and actually our bot is meant to emulate her wonderful manner of being a trusted advisor, firm and to the point, but also loving and, you know, willing to kind of support young people in their questions. But I would say that kind of co-creation phase is so critical. But then the challenge really is how do you get a donor to really support a co-creation phase when you don't have any idea of what the co-creation phase is going to come out? But really, for me, that was a huge learning, seeing how Say It Now, who does this time and time again with clients, putting our trust in them, who put the trust in young people to say, this is what the functionality should look like. And if I have to admit it, I was a little bit weary of where we would get to at the end of the week, but where we got to was miles ahead of what we could have come up with, put up with ourselves. But I actually do have a question for Avert, because I've been listening. There's so many similarities between our two bots, and I guess my question for you is the fact that you've rolled out over several countries, and has that been easy or has that been challenging? Because for us, we've debated so much about language. What language should the bot be available in? What can Google handle and what can Google not handle? And we've also done a really big push around colloquialisms and slang. Well, our bot is for young people, so really trying to understand what the local slang is for asking questions about SRHR. But
I've learned some really weird Ugandan slang.
We have, haven't we? And we always respond with our British slang, so I think they're learning from us as well, right? But I guess, like, how did you deal with that, and how do you adapt to that?
Yeah. So I guess initially, when we were in the scoping phase, we met with community health workers in, as I said, in Zimbabwe, Zambia, and Malawi, with the idea of a part of that scoping, in a sense, was trying to test whether we thought one tool would work for those different audiences and contexts or not, and so based on that kind of phase and the scoping, it felt that what was coming out, the needs that were coming out, were similar, that this tool could support. I think the issue of language is one that we are very keen to develop other language versions of both the app initially, but that we found that hard to get funding for. So the idea of starting with one in English that we could roll out across a few countries at least, to get us more data so that we can then be able to go back to donors again for other language versions with more kind of existing evidence of the impact that we've had with this version. We have worked with a few other organizations to try and get funding for different language versions in both in Zimbabwe and in actually in Rwanda. Neither of those two have been successful at this stage, but we're kind of keen to keep exploring. I mean, at this stage, we have been looking at the app being the initial product that we would translate. I'm interested to, be really interested to hear more about kind of the chatbot development in different languages, and I can, just the complexity in that. Intriguing.
I think as well, I really like your point about slang as well, Erica, and I think that's something that we're sort of learning through testing. So we're doing a lot of active testing with our WhatsApp groups and training the bot sort of as we go and through that way. And I think it's something that we're really keen to continue working on, that's sort of like the beauty of the bot, that it can just keep learning. And we sort of had that built into Twilio where we can just add the different synonyms. And I think that's something that will really develop, hopefully very organically over time, as well as our own input.
I had a quick question that follows on from that a little bit. Recently, when we were doing some training on an application we have for documenting human rights abuses, we talked about unique identifiers for clients. And as an example, we looked at a unique identifier that includes sex as a question, and the number 1 or 2 associated with male or female as one of those included in a unique identifier. And the problem with that is that there is no gender neutral option, and a lot of trans people would want to choose one or the other. And in many countries, your identity number is associated with your sex assigned at birth. So I'm wondering whether there are attempts to try to sort of de-link gender and sex and try to create more inclusive spaces in these chatbots and in online spaces, because there is that opportunity. Supposedly, you know, you can do that in those spaces and allow people to embrace whatever identity or avatar they want. So I'm wondering whether there are those opportunities, whether you've thought through how you make sure that these spaces are inclusive and that language reflects that you're using in your bots. And I think after me, Sophie had a quick question. So maybe we should just ask those two questions and then we can tackle them together. Sophie, do you wanna just ask your question? I know I asked you to type it, but here's your opportunity.
Yeah, that's fine. And I think it has been partly answered by a couple different people already. Thank you so much for all the presentations. I'm such a visual learner, so to see all of the chatbots in action, was so cool. So thank you so much. Yeah, so I always ask a funding question because I'm in the fundraising team at Frontline AIDS, so I'm kind of a one-track mind in a way. But it was interesting because we have seen some calls come up around digital healthcare. And we never know when there is this kind of consultation process where you're working with partners, working out what the best plan of action is, whether it is a chatbot or something else, exactly what platform that should be on and things like that. Have you found that donors you've interacted with have been open to having those discussions and accepting a kind of broad proposal, or will they only come in, and I think this was alluded to, will they only come in once there is a very clear plan of action, once the consultation's been done, and once you know exactly who's going to be involved and what platform you're using, etc. I know, Erica, you mentioned there was there was some legacy funding, so it was a bit more flexible. But it'd be interesting because we do get funding from Gilead, so it would be interesting to hear as well how flexible they were on that kind of project. Thank you.
Yeah, I think, I mean, our experience with Gilead has been that they are very flexible. I think we have been able to outline kind of the aims and the impact that we're trying to achieve without necessarily having to pin down the exact technology that we're planning to use, and that seems to have been okay with Gilead. We've been able to have that conversation. I think you know, it's kind of clear from our projects what the main focus of it is, and I guess because we're around knowledge and health literacy, there are that kind of broad range of tools that we could be using. But yeah, we found them to be one of the more flexible donors.
Well, thank you.
And just want to add that in our situation, it's not Gilead, but in our situation, we just met this problem at the middle of the financial year, and one of the challenges to overcome in the beginning is to prove to management that your idea is needed and will bring benefits and result. And my advice is just before proposing anything, just write down suggestion for no answer from the management and defend your idea to the last. I mean, money and finance, it's not really a useful instrument, but your idea, you need to push it.
Thank you.
Did anyone want to comment on Sally's question around, I think, the gender and sex question, how we collect data and do unique identifier codes and how the bots might help, or, you know, online tech?
From the Ask RHU side, I would say the only time I really struggled with the gender specific, and this is probably due to my very narrow focus, I did a lot of the content development where I spent a lot of time Googling and writing about how to use things like female condoms. But actually, it was really difficult sometimes to, when you imagine the person that would be asking a question of how do I use the female condom, just make sure to answer it very factually and not answer it of having a female in mind in a way. So we try to keep the answers very neutral in that way. And I think because we're also not necessarily collecting that kind of gender specific data at this stage. But Fortunate and Sandra will remember during our code sign phase, we also talked quite a bit about how young women use mobile phones in a very different way from young men using mobile phones, that young women typically have to use a shared mobile phone, whereas a young man will have his own mobile phone. And just really trying to think of the ways that we would try to reach maybe women that don't have a mobile phone, but only have a mobile phone once a week. Don't know if Sandra and Fortunate want to say anything about that.
No, that is indeed what we considered. On the gender thing, we do collect of the users kind of anonymized data of based on supplied Facebook data, and that includes gender, but Facebook allows for more options than male or female. So we do record different ones.
Great, thank you. And thanks, Erica, for introducing the idea of doing this in a gender transformative, or at least a gender aware way, and considering how people use phones differently. And just thinking also in working with sex workers, some of the information that we got from sex use of mobile phones is that they don't use their smartphones when they work. They use much cheaper phones when they work because the risk of them being stolen is really high. And they don't want their expensive smartphones to go missing. So when trying to introduce, for instance, safety mechanisms for sex workers where they might, use a kind of alert system, it won't necessarily work because sex workers don't take their phones with them to work. They might not be allowed to use them in brothels also if they're working indoors, those kinds of things. So knowing the community you're working with sounds like a really key aspect of this kind of work as well.
That kind of thing would really drive the technology choices. If we had been steered in the co-creation phase that SMS-based phones or non-smartphones were extremely prevalent, we would have gone with a different technology solution. Would have likely been Twilio, actually. But that wasn't the case in our particular use case. But it certainly was a consideration and an option to target those less smartphones. And there's always a solution to any of these things once you have identified the need.
Great.
So can you guys believe it? It is, we have 5 minutes left. I think the time has just flown, and there are just I still have a list of questions in front of me that I would love to talk about. So maybe what we could do is maybe I would like to ask kind of, a couple of you, or, whoever wants to, like, what would be your top tip if someone's thinking about kind of pursuing a chatbot or something like that? Because I feel like I almost don't, I feel like I should summarize it, but I almost feel like this top tip method might just summarize our key points from our time together. Yeah, whenever you go for it.
I think that's what we tell all of our clients for chatbots and voice services is start small. To choose a specific small area of expertise to start in, do it step by step. Don't try to create a gigantic artificial intelligence or all-encompassing service or knowledge base. Pick a little battle and start there.
Thanks. Nadia?
Can you hear me?
Yeah.
Honestly, I really inspired all these chatbots and online services, and I would start to rethink globally getting the maximum number of services for our clients online. And I am really impressed by the new goals of the Mayor of Paris, that the services should be available within 15 minutes walking distance. And in our case, it's very good to use chatbots, online services, and why don't we use this in our program? So just for me, I just start thinking about it. So thank you.
Great, thanks.
Yeah, I guess I think really understanding your audience obviously is a key part, and then just not underestimating, I think it's not underestimating the time that it's going to take.
Thanks. Rosie, Erica?
I would add partnerships, just making sure you have the right partners around you. And I think from the beginning, that's what's been so great about Ask RHU, is that the three of us, Say It Now, Ask RHU, we're partners and we bring ideas to the table in a kind of equal, collaborative way of what's going to work, what's not going to work, what's ridiculous. I'm normally the ridiculous one. And then always checking in with young people, like making sure that you're partnering with the community that you serve.
Thanks, Erica.
I guess one thing that we haven't really mentioned, it's too late really to spend much time on it, but I mean, is also thinking about, you know, how you're going to measure, how you're going to understand whether it's working, whether it's doing what you wanted it to do. So thinking through that and the analytics that you're going to be able to get, and how they're going to be meaningful.
Definitely that evidence we need to get future funding. We need to be collecting it.
Yeah, and I think as part of that, definitely thinking beyond just the initial development of the bot and thinking sort of long term from managing the bot and ensuring that it remains useful and meaningful.
Great. Thanks, everyone. Yeah, I think kind of some of my takeaways as well is that how do we sustain this after it's established? What goes into it? And you're talking about it's not actually the tech time, but it's actually the person time and the people behind it. And then I was thinking this piece around, I don't know if you've if people are familiar with the kids movie called How Do You Train Your Dragon? It's like, how do you train your chatbot? And it almost feels like it's really like a program, you know, they're a program. Definitely taking away that co-creation as core, co-creating with who it's meant to help and kind of with the right information, with the right approach. And then I think also another piece that for me really came out of this is around how chatbots and that kind of digital innovation, it doesn't ever stand alone. You know, I see there's the chatbots with the multimedia, with the referrals in, with the option around having like a live handover, and that oftentimes I think when we're in this tech world and thinking about how can tech help with our kind of health and development, it feels very like tech is the answer, but actually it's like, what is this suite of tools and products for our, you know, for our communities? And then I think I like how also Erica was saying, you know, the partnerships, you know, I think it's about having different people around the table that helps us generate those new ideas and to think differently and out of the box. And those are all kind of those elements that, you know, push innovation and move it forward. So I want to thank everyone for your time. I think there's obviously a lot, you know, I think that question around how do we measure what we're doing? How do we know what its, you know, its impact is? It's almost like, I'm going to list that down as like another conversation, because I feel like that applies to beyond just chatbots, perhaps even just that online interventions, kind of the health interventions piece. Thank you everyone for joining us. The time went by much, like always, so fast. We're going to leave the chat open for another like 5-10 minutes. People, you know, welcome, hang out, say hello. Let us know, you know, what you liked, what you didn't like, future kind of topics for discussion. And if you're interested in taking part, you know, please let us know. Thanks again, everybody. And I'm just going to hang on and hang out.
Thank you very much.